One of the most devastating injuries to affect a footballer is rupturing your ACL. We see it all the time. A player ruptures their ACL, they're out for 12 to 18 months because it requires surgery and a long, intense rehab. But the question is, do you need an ACL to play football? This is a very nuanced question. There's tons of different variables, and let's go through a couple of those variables to help you make a better decision. If you're a professional player, a semi-professional player, or a young footballer, the most likely and the safest option is to have surgery. This is because of the age and obviously the level of sport that you play, so there's high demands on your knees. For the recreational footballer, someone who's older, if you're playing 5-a-side or 7-a-side, you may not require an ACL surgery. And the reason being for this is if you have family commitments, financial commitments, if you have work commitments, you might not be able to take that time off to recover and do the rehab after an ACL surgery. And also now with really good new research, we have the research to show us that if you don't get ACL surgery but you do the right rehabilitation program after your injury, there's little to no difference with getting surgery in terms of your osteoarthritis chances 20 years later. But you just need to make sure you're doing the right rehab in order to get back onto the football field.